Right, so thank you for the broader update. Here on the domestic front, there's been a change in the quarantine period for COVID-19 patients in the country, and our Choi Min-jung is here to tell us more about that. Min-jung, welcome.
Thank you for having me.
Right, so there's been a change in the length of isolation for all COVID-19 patients in the country, Min-jung.
Right, starting Wednesday, all COVID-19 patients will have to quarantine for 7 days regardless of vaccination status. Up to now, the 7-day quarantine period only applied to those who were vaccinated, with unvaccinated people required to isolate for 10 days. Also, before the latest change, quarantine began either on the first day of symptoms appearing or on the day of receiving the test results. But now the quarantine clock will start ticking on the day of your COVID-19 test.
Right, and restrictions, Min-jung, have also been eased for those who come into close contact with a COVID-19 patient.
That's right, Sunny. Previously, these people had to quarantine, but they no longer have to if they are fully vaccinated. Instead, they will be subject to passive monitoring for 7 days, and if they experience any symptoms, they can take a PCR test at any time. And if they have no symptoms, they can get a PCR test on the 7th day of the passive monitoring period. And they will be asked to exercise prevention on their own accord, like wearing the masks and avoiding places where they might pass on the virus to other people. Again, this only applies to those who are fully vaccinated, meaning more than 14 days, but fewer than 90 days have passed since their second dose. This also includes those who've gotten their booster shots. However, unvaccinated household members who live under the same roof with a COVID-19 patient are required to self-isolate for 7 days. Those who come into contact with a patient at a high-risk venue like nursing homes and care centers will also be required to isolate. They will be released from quarantine once they get a negative PCR test result after 7 days.
Right. Min-jung, with more people now being asked to test themselves at home, I understand the government is considering a free distribution of self-test kits.
Right, a health official said that the government plans distributing the kits free of charge to those under 60. Currently, only seniors aged 60 and above are eligible for regular PCR testing, and those younger can receive rapid antigen tests at local clinics or buy a self-test kit. However, the government is undecided on who will receive these free test kits, as not everyone might need them. The Prime Minister also mentioned this week that there is a limit on the number of kits they can hand out, given the fact that half of the kits manufactured in Korea are exported abroad. The Health Ministry also acknowledged the need to provide kits to the most vulnerable. So when looking at what's being discussed now, it seems likely that self-test kits will only be provided to people in need or those that face unique challenges in either accessing or purchasing them.
All right, Min-jung, thank you for now, but do stay with us for more talks.